Hey, it's Dr. Blood. I am here with Amy, and we've been working with Amy for some migraine headaches for the last little while. And what we're going to demonstrate today is some of the dry needling techniques that we use on the head and neck that have been successfully alleviating her migraine, the intensity of them, the frequency of them, and the severity of them. So uh, with this, we use teeny tiny needles, essentially acupuncture needles. Now this isn't acupuncture. But we use the needles to get into the soft tissue to try to help the muscles and everything relax from the inside. It's a fairly painless procedure. So the needles are so small you probably can hardly see them on here. So what we initially do, at least with Amy, but in a lot of our headache patients, is we come along the base of the head, and that's where we get a lot of trigger points in what we call our suboccipital musculature. And we place one in. So we hit about 4 to 5 spots typically along the head. And Miss Amy's not even flinching, so it's pretty comfortable, pretty tolerable activity here. So once we hit a few spots in the base of the head, what we do is we go down the neck musculature. So those are our next few spots that we like to hit when we do this procedure on headache patients. A lot of people that are kind of needle phobic, as we call, or have kind of a little bit of a fear of needles, generally actually tolerate this quite well. At least once it's done once, and see how kind of painless and effortless it is. Typically do very well with it. And then the last thing that we typically do for a lot of our headache patients is we utilize the needle, and we like to go into the tight trap muscles. The way this works is we usually don't leave these ones in just to protect you, the patient, but we utilize the needle and we go in and we stimulate the trap muscle, and we hit several spots along the trapezius. Most of us carry a lot of tension, carry a lot of stress in this area, so we get a lot of tight muscles, a lot of trigger points in this area that can refer up to the head, especially the temporal area or up around the eye. So those are very common pain patterns for headaches. We're going to hit one more spot on Miss Amy. So that's how we do dry needling for our headache patients. Hope you enjoyed this video. If you have any questions, leave us a comment or some feedback.